Well, I'm here today to talk to you about lots of different things that we should be aware of in terms of what we need to do to prevent breast cancer. We all know about screening mammogram. We should all get our screening mammogram. But when do we start and when do we stop? And there are some new recommendations about 2 years ago that got things a little confusing for us. So let me clarify. Recommendations is that if you are of average risk, meaning you do not have a high risk of breast cancer in your family, you do not have first-degree relatives who have had cancer, and you do not have any history of cancer personally, then the recommendation is to start at age 40. We recommend continuously doing that yearly and keep going until your practitioner says to stop. That is very important because right now there was imaging recommendations stating stopping mammogram around age 70. Well, we all know that we are living a lot longer nowadays, which means that we can cure cancer if found in the early stages. So please go out and get your screening mammogram. Now, what do you do if you're high risk? And what does high risk mean? A lot of women come into my high risk clinic and ask that question. Well, that just means that you have a greater than a 21% lifetime risk of developing breast cancer. So that can be determined by your physician, who can do a questionnaire for you and put you into what risk category you are. With that being said, if you are a higher risk of breast cancer, then we recommend starting at a younger age. And in fact, we actually recommend adding on special tests like ultrasound or even MRIs to help basically look at the breast in detail to rule out any underlying cancer. So, the answers to the question are: get your mammogram, start at least age 40, talk to your physician, tell them all about your family history, your personal history. Anyone in the family that has developed cancer is very important, and bring this to their light so they can put you into a risk category of when you should start your mammogram. Then, if you have any problems, you can always be plugged into the high-risk clinic. Something else that we should talk about during breast cancer awareness are the signs and symptoms of breast cancer. Not everyone develops a palpable mass. We know that if we feel something, we should say something. But other signs and symptoms can be undetected and patients may not know about those. That includes changes in the skin color, changes in the consistency of the skin or the nipple discharge, a palpable mass, or any masses in the armpit region. Those are definitely some signs and symptoms of getting a mass checked out or any areas in your breast checked out immediately. A lot of people ask, what about breast pain? Do I have cancer if my breast hurt? The answer to that is unlikely. You do not likely have breast cancer that causes pain unless it gets very far advanced. So the good news is you should still mention your symptoms to your doctor, but it's unlikely that you would have cancer if you have breast pain. Something else that I'd like to discuss with you for breast cancer awareness is something that I keep near and dear to my heart, and that's know your options. Every patient that I see, I want them to know all the options that are out there, from a surgical perspective, from a radiation perspective, from a medical oncology perspective. All the options should be available for you. So if you are diagnosed, the answer is to ask questions and know your options. There are so many new surgical techniques nowadays that we are doing right here at Medical City Dallas that can help hide scars. I am a big proponent of hidden scar surgery. The goal for you is to look in the mirror and see yourself and not evidence of cancer. And even a new and improved self if you choose to do reconstruction. So if you are unfortunate enough to be diagnosed with breast cancer, please know that the majority is curable and that there are beautiful options available out there to get you cancer-free and do it beautifully.